At the National Congress of American Indians 2005 annual meeting in Tulsa, Oklahoma, and also at the Funders Network on Population, Reproductive Health, and Rights 2005 annual meeting in Cuernavaca, Mexico, the Native American Women's Health Education Resource Center, NAWHERC, gave the following report. For Native Americans, healthcare is a right, not a privilege for land seized. Indigenous women's reproductive health and rights are human rights, and as such, must be upheld. Indigenous women's reproductive rights include the right to have access to reproductive health care and family planning, the right to reproductive self-determination, the right to bear and raise children, the right to choose the size of our families, the right to knowledge and education for all family members concerning sexuality and reproduction that is age, culture, and gender appropriate, and the right to all reproductive alternatives. We also have the right to receive adequate reproductive health care and health education, to terminate a pregnancy, to safe motherhood, to have or refuse sex, and to demand safer sex practices. Traditionally, among Indigenous peoples, women were considered sacred. They made their own decisions about their reproductive health, and these decisions were respected as the business of women. They had knowledge of natural medicines and techniques necessary to make their periods come or to keep them from coming. Currently, Native American women face the same restrictions as all women. Church and government have imposed their religious ideologies and oppressive federal Indian policies that have restricted many of our traditional practices and original teachings. As a result, women's status and autonomy has diminished. According to statistics gathered by the NAWHERC, Native American women face discrepancies in all areas. 57% of American Indian women reported having had sexual intercourse by the 12th grade. 14 was the reported average age of first intercourse. 42% of all American Indian mothers reported being under the age of 20 when they had their first child. 92% of American Indian girls who have had sexual intercourse reported having been forced against their will to have sex. 62% of those girls reported to have become pregnant by the end of the 12th grade. 27% of American Indian youth reported having received no routine health care in the last 2 years. 41% of American Indian youth reported having no health insurance at all. There is a staggering amount of violence directed against Native American women. The incidence of rape in the American Indian community is 3.5 times higher than among other communities. That means that over 1 in every 3 Native American women will be raped in her lifetime. In a recent survey, 44% of Indian Health Service emergency rooms reported not having an accessible protocol or trained personnel in place for sexual assault. For facilities that do not provide services to sexual assault victims, women are required to travel an average distance of 28 miles and some as far as 150 miles to obtain services. In the 1990s, the Center for Disease Control defined domestic violence as a public health issue. The NAWHERC conducted a survey of sexual assault policies and protocols within Indian Health Service emergency rooms. The results of the survey were released in January of 2005. The findings are as follows. With regards to IHS unit policy and protocol for life endangerment, sexual assault, or incest, the results showed that of all surveyed units, 30% reported that they do not have a protocol in place for emergency services in cases of life endangerment, sexual assault, or incest. 70% reported the knowledge of the existence of a protocol. With regards to IHS service units posting protocol and policies so it is accessible to staff members, although 70% of respondents indicated that there is an implemented protocol, the percentage of service units with the protocol posted and accessible to staff members is only 56%. The statistics reflect a discrepancy between policy and practice. It is the responsibility of area and service unit directors to ensure that services are being provided. 44% of facilities lack trained personnel to perform emergency services in the event of life endangerment, sexual assault, or incest. This indicates a need for more staff in rural areas, in which most of Indian country is found, to provide necessary services. It is necessary that IHS mandate the training of personnel in order to ensure compliance with the law and IHS directives. Those facilities that do not provide emergency services require victims to travel an average distance of 28 miles, while some have to travel up to 150 miles round trip. California has the shortest travel distance, while New Mexico requires the longest travel distance to receive services. The findings from this survey indicate a need to prioritize reproductive health reform among public healthcare providers in Native American communities. It can be seen that Native American women, for whom IHS is the primary healthcare provider, are not being granted access to basic reproductive health care in the event of life endangerment for the woman, sexual assault, or incest. Rape in Indian country is so prevalent that IHS can no longer allow its facilities to neglect this area of care. A participant of the 2003 NAWHERC Roundtable commented, "We look at the trends in Indian health and the statistics, and we'll see girls 12, 13, 14, all the way up to 18 years of age that are pregnant and deliver children. That means rapes that were never prosecuted as rape." The survey revealed that IHS does not have a standardized set of sexual assault policies and protocols within IHS emergency rooms that result in thorough services for those who have been raped and/or sexually assaulted. Without standardized policies, many service units do not collect forensic evidence, which aids in conviction of the perpetrator. The Native American Women's Health Education Resource Center makes the following recommendations for action. Number 1. Guarantee Native American women who have been sexually assaulted access to comprehensive reproductive health care and follow-up, especially emergency medical services within the Indian Health Service. Number 2. Ensure that uniform policies and protocols, such as the Warm Springs Protocol, on rape and sexual assault treatment are implemented and adopted as official policy within Indian Health Service units and their contract facilities. Number 3. Redress the denial and limitation of reproductive health services for Native Americans, which is a violation of basic treaty and human rights. Number 4. Develop a national public education campaign for the prevention of rape and sexual assault in the Native American community. In addition, without standardized policies and protocols, women are denied reproductive health care such as sexually transmitted disease testing and treatment, emergency contraception, PEP, and abortion services. Reproductive health care and rights are basic human rights and an integral part of ensuring that Native American women, and all women, can lead safe, independent, and full lives. For more information, contact the Native American Women's Health Education Resource Center.
Oh,